Most medication errors occur not a result of a single act by a single individual, but as a result of multiple cascading events compounding one another until a potential catastrophe happens. Dr. Lucien Leap, a former Harvard surgeon, conducted a study on the incidence of medication errors in hospitals across the country. From the study results, he and his colleagues estimated that 1 million preventable injuries and 120,000 preventable deaths took place in the nation's hospitals in a single year. One report estimates that medical errors cost the nation approximately $37.6 billion each year, and about $17 billion of these costs are associated with preventable errors. Most errors occur as a result of a chain of events set in motion by faulty system design that either induces errors or makes them difficult to detect, rather than lack of care and concern on the part of our caregivers. As a care provider or medication aide, your focus on following the details of your community's system can help to prevent medication errors. The National Coordinating Council for Medication Error and Prevention has defined a medication error as any preventable event that may cause or lead to inappropriate medication use or resident harm while the medication is in the control of the care provider, resident, or consumer. Such events may be related to professional practice, healthcare products, procedures, and systems including prescribing, order communication, product labeling, packaging, and nomenclature, compounding, dispensing, distribution, administration, education, monitoring, and use. Some adverse events are not preventable, and they reflect the risk associated with treatment, such as a life-threatening allergic reaction to a drug when the resident had no known allergies to it. However, the resident who receives an antibiotic to which he or she is known to be allergic, goes into anaphylactic shock and dies, represents a preventable adverse event. Even if no adverse event takes place, it can still be considered a medication error. Some common causes of medication errors can include lack of knowledge of the drug, lack of appropriate information about the resident, violations of facility policy, slips and memory lapses, transcription errors, faulty identity checking, inadequate monitoring, drug stocking and delivery problems, preparation errors, and lack of standardization. One of the most important fundamentals in preventing medication errors are the 6 rights. The 6 rights concept says that every time we assist a resident with a medication, we need to ensure that these 6 things are done correctly or done right. They include the right resident. Be sure you are providing the medication to the person for which it is prescribed. Follow your facility procedures for identifying the resident. This can include simply a picture in the medication book or other systems. The right drug. Be sure you understand the physician's order and that the pharmacy has provided the correct medication. If there is any confusion related to brand names and generic names, use your drug references or speak to the pharmacist. The right dose. A study by the Massachusetts College of Pharmacy and Allied Health Sciences found that 88% of medication errors involve the wrong drug or the wrong dose. The right time. Follow the physician's orders regarding the timing of the medication. Some medications are simply given once a day, whereas other medications such as antibiotics may be given every 8 hours or every 6 hours. The right route. While most medications in our community are provided by the oral route, meaning they're put in the mouth and swallowed, some medications may be given sublingually, in which they're held under the tongue, topically, such as patches or ointments or creams. There may also be eye drops or ear drops, injections, and possibly rectal medications. Finally, the right documentation. During this video, we will be focusing on how proper and accurate documentation can help to prevent medication errors. If a medication error occurs, it must be reported immediately. Follow your facility protocol for reporting medication errors. This can include immediately notifying your supervisor or manager, as well as notifying the resident's physician. Monitor the resident for injury immediately and initiate appropriate corrective action. If you're concerned about the resident's health or status, seek immediate medical attention. Once the safety of the resident has been ensured and the physician has been contacted, follow any orders or instructions the physician provides. This may include seeking medical help, adjusting future doses of medications, or simply monitoring the resident. Work with your supervisor to ensure a good investigation takes place. How did that error happen? What led to it? And what can we do to prevent it in the future? Also, follow your facility protocol regarding incident reporting. It may be necessary to report this medication error to your state licensing agency. Documentation is an essential part of a good medication delivery system. There are a number of different pieces of documentation that are used. These include the written physician's order, PRN records, narcotics records, records of missed or refused doses, as well as a medication administration record, also sometimes called a medication assistance record, and frequently abbreviated an MAR or MAR. These different pieces of documentation not only create a record of care provided to the resident, but they help to ensure accurate medication delivery. Let's talk more about the MAR. The Medication Administration or Assistance Record is a tool that allows us to document each time a dose of medication is given. On the MAR, we will find a list of all of that resident's current medications, as well as spaces for us to sign off or initial when the medication is given to the resident. The MAR is created based on current physician's orders. It's essential that we keep the MAR up to date. If a dose is changed, a medication is changed, or a new medication added, the MAR needs to be updated. The typical MAR is a monthly record in which a new MAR will be created each month for that resident. In some communities, you may be lucky to have your pharmacy creating the MAR for you, and each month they will send you a new MAR with all of the resident's medications already listed on it. In other communities, we create the MAR in-house. This may be done by hand, using blank forms, or it may be done on a computer. Whichever system you use, again, it's important that that MAR be accurate and up to date. So how do we use a MAR? Let's start by looking at the different sections of the form itself. The actual form may vary somewhat from one community to another, but most of them contain these basic pieces of information. At the top of the form, you'll find a section for the current month and year. As we look down the form, the next section you'll see is for the listing of the medication. Here you'll find the medication name, the dose, and the instructions. Some MARs also include a space to indicate the start and stop date of the medication. To the right of that, you'll see a column for the time. Here we will list the times that that particular medication is to be given, whether it be once a day, twice a day, 3 times a day, or more. Then the remaining columns provide a space to put your initials next to the time that that medication is given each day. You can see there's enough space on the form for each day of the month. After you pour the medication and give it to the resident, you'll sign off by initialing in the box next to the appropriate time and under the appropriate day. So for example, if the medication was to be given at 8 a.m. and today was the 8th day of the month, we would pour the medication, assist the resident to take it, and then we would go back to the MAR under the number 8 because today is the 8th of the month, and next to the 8 a.m. dose of that medication we would put our initials. By putting your initials there, you are saying, I gave this medication to that resident. I ensured that they took it appropriately. If for some reason the resident didn't take the medication, perhaps they refused to take it, perhaps you found out they had left the facility with the family and didn't take their medications with them, whatever the reason was, you would still put your initials because you had poured the medication, but you would then circle it. By circling your initials, you're saying something went wrong. For some reason, the resident didn't take the medication that day. You would then turn to the back of the MAR, or whatever piece of documentation your facility uses, and indicate what happened. You would give the date, time, medication, and dose, and you would give a reason that the dose was omitted or not given. You additionally want to document that the missed dose or omitted dose was reported. It was reported to the physician, to your supervisor, and what instructions the physician gave. Let's talk about entering a medication on the MAR. As we discussed earlier, on the typical MAR, there is a column running down the left-hand side of the form where you will list each medication the resident is taking. Whether you are creating a MAR at the beginning of the month or adding a new medication or medication change partway through the month, it is in this column that you'll want to list the medication, the dose, and the instructions for use according to the physician's order. Whenever you are adding a medication to the MAR, it is critical that you are working off current physician orders. All of the information entered on the MAR should come directly from the physician's order. Do not deviate and do not make any changes. Remember, this MAR will be used to guide your staff when providing medications to your residents each day. A mistake on the MAR will lead to mistakes in medication administration. Once you have the current written physician's order in front of you, find the next blank spot on the MAR and enter the medication. First, you'll enter the name of the medication as indicated on the physician's order. Next, you will add the dose that is to be given. And then finally, you will add the instructions for use, such as in this example, taking 1 milligram every other day. Many of the medications our residents use are taken on a regular and routine basis, such as once a day, twice a day, 3 times a day, etc. However, in some cases, residents may be taking a medication that requires a more challenging administration schedule, such as in this example of taking the medication every other day. Whenever that is the case, it's important that you properly indicate on the MAR how the medication is to be given. Typically, when a medication is given every other day, we will cross out the boxes on the days in which the medication is to be skipped, leaving only room for persons to initial on the every other day schedule. There are often times when there may be a change in a resident's medication. It could be a change in the dose, the frequency, or the medication itself. In these situations, it's important that you clearly note on the MAR that the medication has been changed. Follow your facility policies, but typically you will put a line through the remaining days on the MAR. You will highlight that medication. You will then make a note such as DC'd or changed with the date and your signature. Then you will go to the next blank space on the MAR and enter the new medication or the change in the medication. Again, be sure to put a line through the days that have already passed in the month to show that that medication is starting on that particular date. Using the MER can at times feel tedious, but rest assured that your accurate and thorough use of your documentation tools not only provides an accurate record of resident care, but more importantly, helps to prevent medication errors. Much success to you in assisting with accurate medication delivery to your residents.